good evening to you who's watching us. My name is Henry Mugenyi. Today I come to you differently because I am on a different setup. And to tell you where I am, I'm at the Uganda Heart Institute. And joining me this evening is none other than Dr. Okello Emi. Doctor, a very good evening. How are you? How is it? How is the Uganda Heart Institute?
Good evening, viewers. Good evening, Henry. Thank you for coming back and to have this conversation. The Uganda Heart Institute is great. We're serving the nation, trying to help as many people as possible.
Heart conditions are becoming a public health concern out there. The fact that we're seeing very many people testing. You're the experts. What is the burden of heart conditions in this land?
Yeah, so two things are happening. One is that we've always had some form of heart disease, but the numbers are going up because of the changes in the environment, the changes in the way in which people develop disease. Previously, we had mainly infectious diseases or diseases that spread from one person to another, you know, like malaria, like tuberculosis, like HIV. But now we have the diseases that, you know, just develop in your body due to certain risks. And here we're talking about high blood pressure, we're talking about diabetes, we're talking about different kinds of heart disease like heart attack and heart failure. The other thing is that our ability to diagnose heart disease has also improved. We have better equipment. We are better trained as health workers. Actually, the level of training of health workers in the cardiovascular field is the same, you know, in Uganda as you'd find anywhere in East Africa and indeed around the world. So the ability to diagnose and treat heart disease has improved, much as the number of people with heart disease has also gone up compared to what we had 20, 30 years ago.
If you're to put it in figures, where do we stand as of now?
Children below 5 years, usually it's estimated that 1%, 1 in 100 of children who are born in a certain population. So if you look at our population of 45 million, about 1 out of 100 will have some kind of heart disease that they're born with. So below 5 years, that's what you'll find. When you go above 5, between 5 and 15 years, you still have some children with heart disease that they're born with, but then you have those ones who are starting to develop diseases that develop because they've had infections of the throat that ends up affecting the heart valves. We call that rheumatic heart disease. So in that age group, you have both children with heart defects that they're born with, but also rheumatic heart disease. As you go above 15, you're reaching the 20s, high blood pressure starts to come in. You know, 10, 15 years ago, you'd have high blood pressure affecting people over 40. Now we find 20-year-olds, 25-year-olds, 30-year-olds. And the reason is because the children, our children are getting obese. There's a lot of overweight issues. Those are lifestyle issues. So you find a 20-year-old, you know, is really heavily obese, and that then results in high blood pressure prematurely. And then you carry on, later on such a person may develop diabetes, and then they develop other complications, including stroke, including heart attack, including heart failure. So very, very important that you ask that question. But in terms of the numbers, the most important for us to remember is that high blood pressure, which is a main risk factor, it's like the major driver of most heart diseases, is the most common. And we have research showing that 1 in 4, so if you're 4 people seated somewhere, 1 of you has high blood pressure. And unfortunately, very few people know that they have high blood pressure. The thing with high blood pressure is that when it starts, you won't know. It doesn't cause pain. So we call it a silent killer, actually, because when it shows up, when it starts causing swelling of your feet, starts causing symptoms, by that time it has caused some damage in your body that you may not know. So it's very, very important for you, as I know you're going to ask me, how do you know that you have high blood pressure? For you to measure and know your blood pressure. When you have an opportunity, when you hear there's a camp, when you go to a health facility, please make sure. When you escort someone to hospital, I'm interested in the person who has escorted the patient. You who thinks you're not sick, please make sure you measure your blood pressure. That's the beginning point usually, and you'll find, you'll get surprised that something is there. And then the other, you know, heart diseases really depend on the blood pressure problem. So as a country, if we can screen people who have high blood pressure and treat them and prevent more people from developing high blood pressure, we'll have significantly controlled heart disease in general.
What is the capacity of this institute really to take care of people, the 45 million people that we have in this land?
This theater where we're seated is called a cath lab. Cath lab is very advanced. It's the epitome of cardiovascular medicine. It's a very advanced theater that uses this, if you can look this side, you know, you have these X-ray cameras that beam into the body and show us precisely where we are. And we're able to access your heart through blood vessels in your hand or in your groin, and we're able to unblock a blocked heart artery. We're able to